Welcome back to APP 2015. I'm talking to Hannah Mann, the co-owner of Kimberley Pharmacy Services, recently voted the winner of the 2015 QCCP Pharmacy of the Year. Congratulations, Hannah, on the win.
Thank you.
What does it mean to you and your staff? You must be absolutely over the moon.
Yeah, look, it was surprising. It was really exciting to hear that we had won, and I think it's a real recognition of the hard work of our staff, who work every day to supply medications to a variety of clients all around the Kimberley, and it really is a reflection of what they do.
Pharmacy in an area like the Kimberley must be very different to what most people practice. I mean, can you paint a picture for people about what your pharmacy, the area you service, and what type of things you do?
Absolutely. We're in a really unique position to service 29 different communities across the region in a variety of different roles, and the region that we cover is twice the size of Victoria. So it's very widespread.
Wow, so twice the size of Victoria.
Twice the size of Victoria we send medications around to. And we have clients that travel extensively throughout the region. Most of our clients are Indigenous with a very heavy burden of chronic disease. So we put a lot of time and energy into trying to close the gap and try and make sure that our patients have the best health outcomes possible.
So are you from the area originally?
No, I'm from Perth.
Must have taken a bit of getting used to.
Look, it did and it didn't. Like, it was a really easy decision for me to move to Broome. As soon as I went to the Kimberley, I discovered that I had a passion for Aboriginal health, and I saw it as a really unique opportunity to make some changes and to have an impact on the health outcomes of clients.
Yeah. And what was the reason to go there in the first place?
I went there as a student, actually, initially on a fourth-year placement, and enjoyed it so much I went back for my intern year and then have stayed there ever since.
That's a great advertisement. I know there's problems at the moment getting pharmacists, or pharmacy students rather, to go to remote areas. I mean, there's a big example of what you can achieve, really. So
yeah, definitely. And I think students really need to seize the opportunity to go to remote areas and to rural places, and to kind of get out of mainstream community pharmacy and have a look at the different options that are out there. Community pharmacy provides a really diverse career. It's not just about working in a dispensary and sticking labels on boxes anymore. We provide a huge array of professional services and have a massive capacity to grow community pharmacy.
And what's it like working with Indigenous communities? What sort of things have you done?
Look, I really enjoy working with communities. I spend an awful lot of time visiting sites and visiting clinics and supporting clinicians that work in remote areas. We have a large network of other healthcare providers that we work really collaboratively with, from renal nurses to renal GPs, chronic disease specialists, public health physicians, remote area nurses, Aboriginal health workers, Indigenous medication assistants, GPs, hospital doctors, and we're in a really lucky position to be able to work really collaboratively with a whole range of service providers across the whole region.
And they're people, like a lot of those specialists would come in from Perth, I'd imagine. They're not based in the area, are they? We have visiting specialists, but we have an amazing team of medical staff within the region, supported by the health department and by Kimberley Aboriginal Medical Service, who look at service provision for clinicians. I noticed when the award was announced yesterday, something I found really impressive was the fact they said that you'd work with communities had led to Indigenous medication adherence rates rising massively. I mean, given that's such a big issue normally, I mean, that must be a really tremendous achievement to do.
Yeah, look, adherence and compliance are a really critical part, I think, of medication management moving forward. Supplying medications is only one part of the solution, and I think services need to be provided to support patients to take those medications. Medications are such a significant component of primary healthcare, and if you can't get patients taking medications regularly, you're not going to get the benefit of that. So we put a lot of time and energy into looking at compliance, looking at programs, looking at education as ways to enable patients and to increase the number of days and weeks that they take a medication over a 12-month period.
And it's obviously worked. Have you got any statistics about how much it's gone up? Sorry to put you on the spot.
Look, I don't even think I have them with me. Look, in one of our sites, through the direct work of pharmacy and pharmacists, we've seen a significant increase in the number of times patients coming and collect medication. We have just over 1,500 individual increases, which
Wow.
we've now worked out is over 2,000 additional weeks of medication that have been picked up by clients, which is good. The other things we look at is around dosage times, trying to put people onto dosing regimens that are realistic to lifestyle. Once daily dosing where possible. We use Webster packs and Medi sachets, so we have different sorts of dose administration aids depending on what patients want to do. And I find that if people get given the option to have a choice in what they want to do and how they want to receive their medication, they're more likely to take those.
Okay, so what sort of things? How did you go about getting the trust of the communities and talking to them and working with them? Any sort of strategies you've adopted there?
Look, to be honest, I would think I was in quite a lucky position when I went to the Kimberley. Being young and a new graduate, I had a lot of energy and still do around engaging, with Aboriginal organisations. I find Indigenous culture fascinating. And something that we can all learn from. And look, I really enjoy spending time in communities with clients and Aboriginal health workers and just learning about other people's worldviews and how medications and health are seen by other cultures.
And the service is based in Broome, isn't it?
Yes.
Yeah. I mean, that would be an interesting town to work in general. I mean, it's renowned as being quite multicultural anyway. And,
yeah. Look, and Broome's a beautiful town and a great community, and we're lucky that even with the majority of our clients being outside of Broome, we do get a lot of support from our local community as well, which is invaluable.
And you mentioned before when we were talking that the assessors or the Pharmacy of the Year assessment team came and visited you in the wet season. That would have been an interesting experience.
Well, they did, and we'd had a huge amount of rain the week before, so it was a bit touch and go as to whether or not we would be able to get out of Broome anywhere, because there'd been some flooding on the weekend on a couple of the highways. But we went to Derby, which was good, and it was great that they made the effort, I guess, to come up at the best time of year. And
they didn't think you were keeping them hostage or something by bringing them in the wet season?
No, so that was good. They got in and out okay, and yeah, it was fantastic to have them come up and have a look at what we do. And
have you've obviously told the team back in Broome about the win? Like how
They're
did
very
they
excited.
take it?
They made me a video because it was, unfortunately Broome is a long way away from the Gold Coast, and it would have been great to have, if all of us could be here, but obviously it's a normal working week for us. So they were really excited. So they sent me a video of them all excited in the pharmacy afterwards, which was really lovely, and they do an incredible job.
Well, obviously it must be a team effort. I mean, I know you're co-owners with Terry Batalis, a well-known pharmacist. So.
Absolutely, and Terry has been so supportive of Kimberley Pharmacy Services. We also have a wider network of pharmacies as well. So we're based in Broome, but we also have pharmacies in Derby and Fitzroy Crossing, and they're done in partnership with Cameron and Gillian Unsworth and Travis Lindsay, which is just creates so much additional support for what we want to do, and we wouldn't be able to do what we do in Broome if it wasn't for that wider network of pharmacists and pharmacies.
And I suppose given at this conference we've heard lots of messages of I suppose pessimism, you could say, about the profession. But as a young pharmacist that's out and about and you're doing a great job, being recognised for it. I mean, what message would you have for other pharmacists who are maybe thinking like, having second thoughts about being a pharmacist?
Look, I think we're in for difficult times. We don't have stability at the moment. I think the issue we have, and it's been talked about a lot at this conference, is this need for services to be funded. We provide a massive amount of services to our patients, and I feel like we have a really high level of service and do the very best we can. But at the end of the day, none of those services that we actually provide are funded by the government. Should they be? Absolutely. For them to be sustainable with price reductions, they must be funded in some way. Because otherwise the only people who suffer in the end are our clients, who, if pharmacies like mine aren't viable moving forward.
And
what happens to those patients over an area twice the size of Victoria who then have no medication?
And would have probably no other medicine access, I suppose, as well.
Well, that's it. And, I think the services that pharmacy provide are so valuable to the primary health care. And I think we do a lot. And we've always done a lot that we didn't really talk about before, and now is the time to talk about it and to talk about what we do and to fight for funding and to fight for recognition of the services that we provide, because they're invaluable to the community.
Okay, thank you very much for your time, Hannah. And
Is that all right?
I think you do a great job, and congratulations on the award. Thanks very much.
Thank you.
We'll be right back from APP 2015 from Pharmacy News.